Hematocrit.
The hematocrit, also known as packed cell volume or erythrocyte volume fraction, is the volume percentage of red blood cells in blood. It is normally about 45% for men and 40% for women. It is considered an integral part of a person's complete blood count results, along with hemoglobin concentration, white blood cell count, and platelet count. In mammals, hematocrit is independent of body size.
Etymology.
The term hematocrit comes from the ancient Greek words hema, or ema, blood, and krites, judge. It was coined by Magnus Blix at Uppsala in 1891 as hematocrit, modelled after lactocrit, which was used in dairy farming. See also, Scudder and Self in NEJM October 30, 1941 225 18 pages 679 Controlled administration of fluid in surgery.
Measurement methods.
The packed cell volume, PCV, can be determined by centrifuging heparinized blood in a capillary tube, also known as a microhematocrit tube, at 10,000 rpms for 5 minutes. This separates the blood into layers. The volume of packed red blood cells divided by the total volume of the blood sample gives the PCV. Since a tube is used, this can be calculated by measuring the lengths of the layers. With modern lab equipment, the hematocrit is calculated by an automated analyzer and not directly measured. It is determined by multiplying the red cell count by the mean cell volume. The hematocrit is slightly more accurate as the PCV includes small amounts of blood plasma trapped between the red cells. An estimated hematocrit as a percentage may be derived by tripling the hemoglobin concentration in gram per deciliter and dropping the units. There have been cases in which the blood for testing was inadvertently drawn proximal to an intravenous line that was infusing packed red cells or fluids. In these situations, the hemoglobin level in the blood sample will not be the true level for the patient because the sample will contain a large amount of the infused material rather than what is diluted into the circulating whole blood. That is, if packed red cells are being supplied, the sample will contain a large amount of those cells and the hematocrit will be artificially very high. On the converse, if saline or other fluids are being supplied, the blood sample would be diluted and the hematocrit will be artificially low.
Elevated.
In cases of dengue fever, a high hematocrit is a danger sign of an increased risk of dengue shock syndrome. Polycythemia vera, PV, a myeloproliferative disorder in which the bone marrow produces excessive numbers of red cells, is associated with elevated hematocrit. Chronic obstructive pulmonary disease, COPD, and other pulmonary conditions associated with hypoxia may elicit an increased production of red blood cells. This increase is mediated by the increased levels of erythropoietin by the kidneys in response to hypoxia. Professional athletes' hematocrit levels are measured as part of tests for blood doping or erythropoietin, EPO, use. The level of hematocrit in a blood sample is compared with the long-term level for that athlete, to allow for individual variations in hematocrit level, and against an absolute permitted maximum, which is based on maximum expected levels within the population, and the hematocrit level that causes increased risk of blood clots resulting in strokes or heart attacks. Anabolic androgenic steroid, AAS, use can also increase the amount of RBCs and, therefore, impact the hematocrit, in particular the compounds boldenone and oxymetolone. If a patient is dehydrated, the hematocrit may be elevated. Capillary leak syndrome also leads to abnormally high hematocrit counts, because of the episodic leakage of plasma out of the circulatory system. Sleep apnea has been known to cause elevated hematocrit levels.
Lowered.
The mean corpuscular volume, MCV, and the red cell distribution width, RDW, can be quite helpful in evaluating a lower than normal hematocrit, because they can help the clinician determine whether blood loss is chronic or acute, although acute blood loss typically does not manifest as a change in hematocrit, since hematocrit is simply a measure of how much of the blood volume is made up of red blood cells. The MCV is the size of the red cells and the RDW is a relative measure of the variation in size of the red cell population. A low hematocrit with a low MCV with a higher DW suggests a chronic iron-deficient anemia resulting in abnormal hemoglobin synthesis during erythropoiesis. 1 unit of packed red blood cells will elevate the hematocrit by about 3%. Groups of individuals at risk for developing anemia include infants without adequate iron intake, children going through a rapid growth spurt, during which the iron available cannot keep up with the demands for a growing red cell mass, menstruating women, which have a greater need for iron because of blood loss during menstruation, pregnant women, in whom the growing fetus creates a high demand for iron, patients with chronic kidney disease whose kidneys no longer secrete sufficient levels of the hormone erythropoietin that promotes a BC proliferation. Erythropoietin prevents the death of cells in the erythrocyte cell line in the bone marrow. Therefore, erythropoietin allows those cells to continue to mature, exit the bone marrow and become